Hi, and thanks for checking the video. I will quickly introduce you our work about the previously uncharacterized long non-coding RNA that we named LENOX. Melanoma is an aggressive skin cancer that arises from melanocytes, and when melanoma cells invade the dermis and disseminate to other organs, the disease becomes almost lethal. And this even if after the introduction of target therapies and immune checkpoint inhibitors to the clinic. The problem is that melanomas are highly heterogeneous and comprise distinct populations that can expand over the course of therapy and promote resistance. Combinations of different drugs have been proposed to target each of them, but rare common vulnerabilities also exist and could be exploited to reduce the risk of minimal residual disease. For this reason, we reanalyzed the data of single-cell RNA-seq of a melanoma PDX and selected the top 50 mRNA and long non-coding RNAs whose expression had the lowest coefficient of variation across all drug-tolerant states. Among long non-coding RNAs, LENOX was highly expressed in melanoma samples but poorly in normal tissues and at comparable levels in not described melanoma populations. To investigate LENOX functions, we combined analysis of its expression with assays to determine its mechanism of action. We found it to interact with the RAP2C GTPase and both of them localized at mitochondria. This brought us to evaluate a role in mitochondrial function in cells knocked down for LENOX or RAP2 or ectopically expressing LENOX. These experiments allowed us to build a model in which LENOX probably acts as a scaffold between RAP2 and RIP1 to regulate the activity of the latter in a negative manner. This would balance the positive role of ERK1/2 and maintain an equilibrium between cycles of mitochondrial fission and fusion. This complex seems to be important not only at steady state but also in situations of metabolic stress, such as the inhibition of the MAP kinase pathway. Indeed, melanoma cells adapt to BRAF or MEK inhibition by increasing mitochondrial elongation and oxidative phosphorylation. We found that concomitant LENOX or RAP2 knockdown blocked this effect and sensitized melanoma cells to apoptosis. In conclusion, we propose LENOX as a pan-melanoma survival long non-coding RNA that acts as a scaffold between RAP2 and RIP1 to regulate mitochondrial function. LENOX could represent an attractive target to reduce the risk of recurrence in patients and increase the efficacy of MAP kinase inhibitors. If you want to get more details about the project and discuss it together, please join my live session during the conference.